Hello, everyone, and thank you for joining us today to discuss revenue enhancement for outpatient surgery. We'd like you to note that we make every effort to ensure the accuracy of the information we're presenting. However, it's important to note that Medicare and other regulatory guidelines are constantly changing, and therefore it's important to ensure you're always remaining up to date on the changes. A little about myself. My name is Jennifer Asencio, president of Garfunkel Health Advisors. I've been in the healthcare compliance industry for over 20 years in various roles, with focuses mainly on compliance program operations, coding, documentation, and also provider education. I am certified in healthcare compliance through the Healthcare Compliance Association. I'm certified professional coder, certified professional medical auditor, and certified professional compliance officer, all through the American Academy of Professional Coders. With me today is my colleague, Simon. Simon, take it away.
Great, thank you. Welcome everyone to today's webinar. My name is Simon Chaykler, and I'm one of the associates here at Garfunkel Health Advisors. Some background information about me. I'm a certified medical coder, as well as a certified medical auditor through AAPC. I also have a certification with AHAM, the Certified Revenue Cycle Executive. My areas of expertise are within revenue cycle integrity, documentation and coding, medical auditing, and compliance. Okay, so in today's ever-changing healthcare landscape, revenue cycle process in outpatient surgery department encompasses the entirety of administrative and clinical functions essential for capturing, management, and collection of patient service revenue. This cycle, as many of you are aware of, is the lifeline for both your facilities and your providers. It determines not just the financial health, but also impacts the operational efficiency and the satisfaction of the patients. So the revenue cycle begins when the patient or the provider schedules the patient for surgery, and typically ends when the payment has been received and the account has been fully reconciled. So there are three main groups involved in the RCM. It is the patient, the provider, and then the payer. The payer can be an insurer such as Medicare, for example, or the patient themselves who are responsible for a portion or the entirety of the cost. As a result, multiple stages in the revenue cycle ensures effective communication and action among all parties are taken to achieve the end goal, which is to get paid. Today, we're going to dive into a little bit deeper into the world of RCM for your organization. We're going to explore the challenges that are faced on a daily basis, as well as enhancements that could be put in place to achieve efficiency, precision, and most importantly, compliance to the highest standard. So let's take a look at the entire revenue cycle integrity process in one snapshot. As you can see, the process is broken down into three components: the front end, the middle, and then the back end. Each of these processes, again, is the lifeline to the cycle and to your facility. The front end process is typically patient-oriented and begins when the patient schedules for some type of service. In this case is the surgery. As you can see, the process ends when the patient registers at the point of contact and completes all the required paperwork. So much of the pre-care work focuses on complying with guidelines and ensuring that parties understand the financial obligations associated with the care provided. One significant challenge we see that facilities and providers face is related to the cost sharing. As a result, financial counseling is one important critical component that is typically bypassed by many facilities. So what is really financial counseling? Well, financial counseling is used to provide patients with guidance and information about the healthcare services, payment options, insurance details, and potential financial assistance that the patient might require. So by offering financial counseling to your patients, you can adapt a proactive approach that aims to A, increase efficiency, and reduces the amount of unpaid bills to ensure that the patient knows their financial obligation. Moving on to the middle process, this is where resources are now tracked and recorded. Once the patient reaches the point of care, the healthcare professionals document all necessary information in the medical record, including but not limited to a history and his physical, operative report, discharge summary, and so on. This process begins the record keeping and ends by ensuring that the provided care is accurately translated into billable services. As you probably already know, the process requires a significant amount of management and oversight to ensure full compliance. And later in today's presentation, we'll see some of the details necessary to achieve an efficient middle process. Finally, the back-end process involves preparing the claim for submission to the payer and ensuring that the expected reimbursements are collected. The entire revenue cycle process ends with the claim when the claim is paid and all patient financial responsibilities are collected. And again, we're going to go over it a little bit more in detail shortly. So now I'll turn over the presentation to Jennifer, who will discuss some of the pitfalls and enhancements of the front end and middle end processes. Jennifer?
Thanks, Simon. So a lot of what we're talking about today are things that, well, if you're in the industry, then it's common knowledge. But what I want you to keep in mind is, okay, you may know it and your practice is doing it, but are you making sure it's done every single time and correctly? So let's talk and dive into a little bit more of those front-end processes of scheduling and prior authorization. It's so important to ensure that patients are scheduled properly, as this is the very beginning of the process. So when booking appointments, it's important to select the correct visit type, as well as determine if there are any referrals. Next, it's crucial to gather the correct patient insurance information and verify the patient's eligibility. So what type of coverage do they have? Are there any secondary insurances? Are there deductibles, co-insurance, or co-payments? Another very important piece to this process is that certain procedures or treatments may require prior authorization, and any missteps here could result in a complete denial of that procedure. So the accuracy of the information collected during this process of scheduling and prior authorization will be the key to achieving a clean claim submission. So also included in this front-end process is pre-registration and registration. So this includes the collection of all of that demographic information for the patient, taking copies or scans of the patient's ID and insurance cards, as well as collecting all of those important consent forms. Then there is collection of copays or co-insurances. Now, again, we all know this is part of the process, but the question is, are your staff ensuring that they're collecting at the time of the visit each and every time? And if not, well, the practice will end up spending a lot more money to collect the copayment than the actual copayment itself. Financial counseling is the last piece. Now, Simon did a great job explaining this part earlier, but what I do want to add is that if the patient has Medicare, then they might need to sign an advanced beneficiary notice, otherwise known as ABN. So this ABN will help the patient make informed decisions about items and services that Medicare usually covers, but may not in specific situations. The ABN lists the items or services that the provider expects Medicare will not pay for, along with an estimate of the cost for the items and services and the reasons why Medicare may not pay. So this form needs to be completed, signed by the patient, and then scanned into the patient's medical record. Overall, any miscommunication or data entry errors during the pre-registration and registration process could delay the entire billing process and then result in increased accounts receivables, denials, and potentially lost revenue. Nobody wants lost revenue, right?
So one thing I do want to add here is Jennifer mentioned consent forms. Typically, when we do audits, we always see that one or more consent forms are either missing or outdated. And I cannot stress this important. Consent forms is one of the most important things that must be on file. For example, such as the risks and benefits consent form. When you're doing surgery, the provider must go over the risks and benefits with the patient, and that consent form must be on file. Another one is your HIPAA forms, your privacy and privacy of notice of privacy practices, and so on. They must be completed at the point of care when the patient presents to your office or surgical centers.
So how can we improve all of these front-end operations? Well, ensuring that there are no changes to the patient's insurance and getting the consent forms are pretty obvious, right? But the question again is, are you ensuring it's done at every encounter? Simon just explained how important, getting those consent forms are. And as he said, that is one of the two most common things we see when we're auditing a practice or facility. The other one is that the insurance that's entered in the billing system doesn't match with the actual insurance card that's scanned. It's outdated, it's not the most up to date. And then getting back to those HIPAA or consent for treatment forms, according to the Journal of American Medical Association for Surgery, handwritten paper-based consent forms have error rates as high as 50%, which can affect patient experience, patient understanding, and clinic and operating room efficiency. One way to improve that process is to implement an electronic-based consent form, or e-consent. This can help improve the quality and consistency of documentation, eliminate illegible or misplaced forms, but most importantly, enhance patient safety. Another way to improve the front-end operations is to reduce that manual data entry and, of course, the time spent registering patients. So the manual piece right there, that's the big part of how incorrect information could be added. Even just transposing a number on the patient's insurance card could result in denials. So patient portals can provide a digital pre-registration that encourages patients to complete and verify information, including their insurance coverage. The portals can also collect the patient's co-payments or co-insurances prior to their arrival for the appointment. Additionally, automated insurance verification tools can streamline front-end revenue cycle processes. These tools integrate with the patient's databases and the practice management system to verify a patient's coverage and benefits in real time. Implementing this technology can speed up the verification process and again, reduce that risk of manual data entry errors. Now, moving on to the middle processes of the revenue cycle is medical record documentation. So let's talk specifically about operative report documentation and why that's so important. So as you can see here, listed are all the components of an operative report. This report is the actual proof of service. So it helps support medical necessity, which is required for any service, not just a procedure, but any billable service. And it's not just for the surgeon's reimbursement, but it's needed for the reimbursement of the whole facility, as well as the members of the surgical team. Everybody wants to get paid for the services they're performing, right? So what happens when the components of the documentation are missing? Well, poor documentation can result in unbillable procedures, causing a loss in revenue. Poor documentation also poses financial risks in the event of a payer audit. The documentation won't support the procedure being billed, and that results in a takeback of the money. The facility should have certified coders that can abstract the operative report information and determine the correct code to bill. If the certified coder sees that there are any incomplete portions of the operative note or medical record, they should then query the physician immediately so that they can add any information that may be missing. So when we talk about services being provided, right after that, then the charges need to be captured for each of the services. So this other piece of the middle processes of the revenue cycle is charge capture and charge entry. So this includes capturing your CPT codes, your modifiers, ICD-10 diagnosis codes, amongst other things, in order to bill out the services to a payer. And really the goal of the charge entry and charge capture is to automate that process so the information just automatically flows into the practice management billing side based on what the provider enters into the medical record in their documentation. Because again, we want to reduce all of those manual data entry errors. So let's talk a bit first about the Charge Description Master, or CDM. A CDM contains all chargeable professional and facility technical charges, as well as billing descriptions, HCPCS codes, CPT codes, revenue codes, modifiers, just to name a few of everything that's in that CDM. And it must be kept to date, otherwise failure to effectively manage the CDM could lead to incorrect bills, missed reimbursement opportunities, potential compliance and regulatory risks. When the CDM is out of date and doesn't contain the current procedures, services, and products, it prevents the organization from billing these items and could cost the organization millions of dollars. So therefore, it is crucial to ensure that you have a process in place for keeping the CDM as updated as possible. Also, using technologies such as coding tools and smart edits that can also help reduce errors. Certain medical records and practice management software tools have the tools to help providers and/or coders select the right CPT codes, as well as provide these what we call smart edits up front. So a good example is if the provider or coder was selecting two CPT codes that are actually bundled together and can't be billed together, and upon entry, the software would immediately show an error and that these codes cannot be billed together. So again, we talk about streamlining time and efforts. And lastly, it is always a good idea to conduct regular audits on processes. If there are consistent errors or issues happening, then it's time to take a deeper dive and see what the root of your problem is and correct it. Performing audits of your medical record documentation and coding is also a wonderful idea. This can help prevent audits from CMS and commercial carriers, as well as routine revenue if audited. Many providers that we work with will ask about trends and patterns, and will I get audited from CMS, and how can I not get audited from CMS? There's always a chance, but if you arm yourself with the knowledge of correct coding and strong documentation, if you're audited, you can pass that audit with flying colors. So now I'll turn it back to Simon to talk about claim submission.
Great, thank you, Jennifer. So this marks the beginning of the back-end process of the RCM, where all efforts are now directed towards collecting the appropriate reimbursement for the services provided to the patients. After the charge capture is complete and all charges are now finalized, the facility and the provider now begins to prepare the claim for submission to third-party payers. In this step, we often refer to the term as a clean claim, right? Many of you probably heard it. So clean claim refers to a health insurance claim that has been accurately completed and submitted without any errors or omissions. When a claim is clean, it can be processed without needing additional information and doesn't have to be sent back to the provider for correction, resulting in 1, quicker payments, and 2, most importantly, lower age accounts receivables rate. One thing we emphasize is the importance of ensuring that the practice has their aged accounts receivables rate as low as possible. Also, prior to the claim leaving the internal system and processing through the clearinghouse, all claims should be ran through an internal audit system known as the scrubber. The scrubber detects and corrects billing errors such as mismatches in dates of service or incorrect revenue code assignments, reducing the amount of claims that are being denied or rejected by the healthcare payers. Again, this is a proactive approach. We all know that insurance carriers always have a strong scrubber. So as a way to prevent payments for these services to be paid timely, we encourage everyone to have claim scrubbers in place. So what affects a claim to be rejected or denied by insurance or clearinghouse? It could be due to, for example, incorrect insurance carrier information. This can result by sending the claim to the wrong insurance carrier because your front end staff forgot to update the patient's insurance on file. Another reason could be due to missing or incorrect CPT codes billed out on a claim form. This is quite common one that we see. Remember, AMA releases and deletes certain codes that go in effect as of January 1st of every year. So it's important, like Jennifer said, to keep your charge master up to date and ensure that all CPT codes are valid and correct. Next is timely filing. Often providers get caught up in doing other things such as treating the patient, and the operative report becomes late in completion or signature. So unfortunately, when timely filing occurs, there are no chances to appeal the claim. Thus, it results in a loss of revenue. So it's always important to encourage providers and to complete the operative reports on time. And finally, missing authorization numbers. This could be either the authorization was never obtained from the insurance carrier, or the authorization was never added to the claim when submitted to the insurance carriers. So from our experience, many of these issues could be prevented if a proactive measures are put in place. So what are the proactive approaches, some of you may ask, right? Well, they are running consistent reports to keep track of the front end, provider documentation, and back end issues. Tracking to see if the claims are going out the door to the correct insurances, ensuring that insurances are being billed to the secondary insurance if it's a Medicare patient is crucial and important. And the way you can achieve that is by running those consistent reports to keep track of them. Number 3, and this is a big one, is ensuring that you have system edits in place, such as your NCCI edits, your mutually unlikely edits, as well as the outpatient code editor. By having these scrubbers in place, you're going to be able to detect the issue before the claim goes out the door. And finally, stay up to date on new guidelines released by CMS, AMA, and your professional societies. Although this seems like a very obvious thing to do, but we typically get very comfortable in what we do, and we don't really pay attention to the new updates that are being released. So again, a proactive approach is to check out the CMS website, check out the AMA website, refer to your professional societies to see on guidance that are given for submitting clean claims, for the use of the CPT codes, and so on. HIPAA simplification. We're not going to get into too much detail on the HIPAA required standard transactions, but it's crucial to note that when submitting claims to insurance carriers, any insurance carriers, we must adhere to these guidelines. For instance, all claim forms must include the correct dates of services, diagnosis codes, procedure codes, insurance carrier information, and so on. Although some of this is common sense, we constantly see clients, for example, forgetting to put the authorization number on the claim forms. So be aware of these requirements as they are standard throughout any insurance carriers and are required for both the CMS 1500 claim form and the UB04s. And finally, claim denial management. Claim denial management is one of the most important aspects of revenue cycle management. It is the process of systematically investigating each claim denial or underpayment by analyzing why each line item was denied or underpaid by the insurance. The goal of analyzing denial patterns from insurance carriers and adjusting the process is to prevent or decrease future claim rejections and denials. Each outpatient surgery department should achieve at least a first pass rate resolution of 90%, meaning that 90% of the time when you submit a claim, the claim is clean and gets paid on the first submission to the carrier. One thing to keep in mind is that the denial process can be a very expensive and costly process. But by having the right tools, you can avoid that and ensure that everything is properly submitted to the insurance carrier. Again, we cannot stress this enough. Be proactive, not retroactive. As a result, denial and follow-up process is pivotal to your organization. Enhancing this process can lead to improved cash flow, better patient satisfaction, and a more efficient billing operation. Some suggestions to boost the efficacy of the process is to have a designated team of professionals. Make sure that that team specializes in payer denials and can address and understand why a claim is being denied. Next is to understand the root cause of the denials. Are the denials coming from a front-end administrative issue such as missing authorizations or registration issues? Or is it a provider-related issue like timely filing, insufficient documentation, and so on? Do the analysis to figure out the root cause. And finally, we always say to the clients, educate, educate, educate. And I cannot stress this enough. The front end clinical staff and back end should all receive continuous education and feedback on their errors so that next time they are aware of how correct processes should be done. Here I included a sample snapshot of a tracking system that could benefit your practice. There are many reports that your EMR system could run for you. So utilize those EMR systems to the full extent, such as looking at your payer mixes, your claim denials rate, the claim appeals rate, and so on. Nowadays, most EMR systems have the ability to not only run standard reports, but for you to customize your own reports that will be beneficial to your internal team and for you to analyze what the root cause of some of these denials are. Use all the tools you have to your advantage. And finally, as we wrap things up, let's go over some recommendations and takeaways. As you can see from the pie chart here, the CIRC data, nearly 64% of improper payments are as a result of insufficient documentation. And that is a huge number that should not be taken lightly. As a result, establish internal policies and processes. Have a clear and strong policy that outlines the requirements for your providers. For example, all operative reports should be completed within 72 hours from the date of service. Another thing is that if you have assistant at surgeons, make sure that the operative reports have the medical necessity documented in them. Another enhancement would be to adopt billing software that integrates with the EHR system for more accurate billing data extractions. The billing system should have smart edits and claim edits in place, just like Jennifer said, to boost efficiency. And finally, establish a rigorous quality assurance system in which every department gets routinely monitored and audited. For example, for the front end, run continuous reports to ensure that the consent forms are on file, patient demographics are correct, prior authorizations are obtained, and so on. And to wrap things up, we have included some useful resources to common websites, such as your CMS, manuals, and so on. And I want to thank everyone today for joining us on this webinar of revenue enhancements. Thanks, everyone. Take care.